morning. So how long should I stay on Suboxone? We get asked this question all the time. And I think in some ways it's fairly obvious that Suboxone can be really helpful. We've been detoxing people off Suboxone now, for about 17 years when people are ready to come off of it. And that's somewhat predictable and sort of logical as to when people are ready to stop using Suboxone. The whole idea of Suboxone is that it's a maintenance drug that gives you a long, slow, steady opioid effect that's a partial agonist, so it's not really giving you a dopamine rush. It's just giving you a steady level that's keeping your opioid receptors happy so that it decreases cravings. And it also protects people if they overdose or if they mess up and use some opioids or some other drugs. So it can be life-saving and incredibly valuable for people. And that's the whole idea of using it. So we actually have a branch of our company now called Applegate where we have patients on Suboxone who that's the best treatment for. But we also detox people off, and when we do, we like them to go on Naltrexone for at least a year, long-acting Naltrexone using either Vivitrol or implants, so that they can then adjust to that, because the last thing we want to do is take people off Suboxone where it's been working for them and then have them with nothing and then relapse back to street drugs. So what are the things we look at? Well, my definition of recovery for people who are on Suboxone or Methadone is that there are three things. They're using the drug as prescribed. They're taking it with the doctor's prescription, and they're not taking more, they're not taking less. They're not using any other mood-altering drugs, because we know that when people have an addiction, if they get off one drug but they keep smoking pot or drinking alcohol or doing other drugs, it just increases their relapse risk dramatically. And the third is that they're working a program. And what I mean by that is an emotional, spiritual recovery program where they're improving themselves. They're learning about why they got on drugs in the first place, what their genetic loading is, what their environment is, what their relapse risk is. And so when people are doing those three things, then in my way of looking at it, they're in full recovery. And so then the Suboxone's helping them to do that, and then the question is, how long do you stay on that? It's a little bit like asking a patient with a broken leg, how long do I keep using my crutches? Well, the answer is until you don't need them, until your brain is fully healed as far as the addiction goes, and you're not walking on risky ground, you're not likely to trip and fall. So we look at stability. We look at people who are in a good relationship or they're stable by themselves. They've maybe got a job that they're happy with. There's not a lot of stress. There's not a lot of depression or anxiety. They're following up with their doctor. They've got support groups going. They are involved with their recovery program. And when people are doing that, then they probably don't need the Suboxone again anymore. So we can detox them, and it usually works out incredibly well. We want to keep a close eye on people for at least 12 months after that, because the Suboxone often is very powerful, and they don't know what they don't know, so they don't know how much cravings and stuff are going to come back. But we just detoxed somebody. Actually, she was on methadone, and she'd been in recovery for about 9 years. She was newly married with a couple of kids. She had a good steady job, a nice relationship. She had a good support system going, and she just didn't need her methadone anymore. So we detoxed her over 9 days, and the detox went well, and she's doing really well. And I think that's a great way to do it. So hopefully that information is helpful. If you have any questions, please call us and let us know for future topics.